Good morning, everyone. My name is Utome Awu. Today, we are pleased to welcome you to our group presentation for Global Operations Model, and I'm joined with my teammates, Yvier and Gabriel. We'll be critically evaluating the impact of globalization on the adoption of lean production in NHS UK. I will be discussing the origin of lean production, NHS Health Check Program before COVID-19 and post-COVID-19. Firstly, the origin of lean production dates back to the Toyota production system, which is linked with the unique necessities and challenges faced by Japan in the post World War II era, particularly in the 1950s. Japan's industrial infrastructure was largely destroyed during the war. Rebuilding required immense capital, which was in short supply. This made large-scale capital-intensive mass production impractical. This was where lean production arose as Japan rebuilt its economy. Furthermore, I want to also talk about the NHS Health Check Program before the pandemic, I mean the COVID-19 pandemic. The NHS Health Check Program prior to the pandemic was a significant public health initiative in England aimed at preventing serious yet often preventable conditions and diseases. Yet, it was launched in 2009. The NHS Health Check was a national prevention program that offered a free NHS healthcare in the UK and was based on the residency status rather than nationality. People ordinarily resident in the UK lawfully were eligible. British citizens, permanent residents, and people with indefinite leave to remain were also eligible. Other citizens from European Economic Area and Switzerland were eligible as well to access the NHS services in the UK. Lastly, the transformations in the service delivery post-COVID-19 pandemic acted as an unprecedented catalyst for rapid and significant transformation in NHS service delivery across UK. While many of these changes were already part of the NHS's long-term strategy, the pandemic drastically rather accelerated their implementation, driven by urgent need to manage infection risk, free up capacity, and maintain essential services. Some of the key transformations observed in NHS UK service delivery post-COVID-19 include accelerated data transformation, which is the most significant and visible change. Prior to the pandemic, face-to-face GP appointments were the norm. Almost every overnight, general practices shifted to a digital first approach with a massive increase in phone and video consultations. Also, expansion of NHS app was eminent. The NHS app has become a central hub for the patient interaction, and its functionality has vastly expanded to include booking and managing COVID-19 and flu vaccination appointments, ordering repeat prescriptions and receiving messages and alerts from GP surgeon. Then the remote monitoring and wearables. The pandemic necessitated the adoption of monitoring regulatory practices by patients with COVID-19 and also for patients with chronic conditions. Wearable devices and home monitoring equipment allow healthcare professionals to track better decision making. Then on the increased working system working, I mean the integrated care system, the pandemic highlighted the importance of collaborative working across different parts of the health and social systems. Integrated care systems are being formalized to bring digital NHS organizations and local authorities along with other partners. I will give room for my colleague Gabriel to continue.
So today I'll be talking about how the NHS service in the UK has adopted lean methodologies to improve their healthcare delivery. So specifically, we're going to look at how they have tackled waste, which we like to call MUDA, and as well as MURA, which is termed unevenness, and MURI, which refers to overburden. So I'll start with MUDA. So in the context of lean thinking, waste is anything that doesn't add value to the patient or the system. So the NHS has been working to eliminate waste in a number of ways that includes cutting down on unnecessary procedures and using resources more efficiently. One of the big wins here has been reducing patient times, which is not just a service, but it's not a service issue, but a public concern. So people don't want to wait around for hours or days for care they urgently need. On top of that, lean practices are helping the NHS manage their budgets effectively while they're still maintaining high quality care. So, for example, using lean to tackle hospital acquired infection help cut costs and improve outcomes at the same time. Now, moving on to a broader adoption of lean methodologies. What's interesting is that the benefits go beyond just cutting waste. The NHS has seen a very like a real improvement in operational efficiency, and a study even showed that 78% reduction in discharge waiting times is a very huge improvement in the NHS sector. So staff utilization has also improved, lean practices, allocated resources, and manage patient flow better. It's not just about being faster or cheaper, there's also a quality benefit. Lean encourages continuous improvement and focuses on outcomes by reducing waste and improving flow. Staff can actually spend more time on what matters most, which is patient care. So ultimately, lean leads to higher quality of service. Now let's talk about the other concept, which is Mura and Muri. Mura or unevenness is about the inconsistency in processes that leads to poor outcome. So NHS, this could mean like uneven staff scheduling or variation in how procedures are done. So by standardizing these processes, the NHS has been able to provide reliable care with fewer surprises or setbacks. Finally, we have Miri, which is overburdened. This is a big issue in the healthcare where staff are often pressured to do more with less, and overburden leads to burnout, errors, and even staff turnover. So lean actually helps by streamlining workflows and distributing tasks more evenly, so people aren't constantly overwhelmed. But it's important to note that while lean has helped, these challenges has not disappeared completely. Overburden and variability still exist in the NHS sector. But the key is that lean gives the NHS a better framework to tackle these issues systematically. So in summary, lean adoption is in the NHS isn't just about efficiency. It's transforming the way care is delivered. It reduces waste, improves patient outcomes, enhances staff effectiveness, and it also supports sustainability and high quality care. I'll leave it for my colleague to continue the presentation. Thank you.
Good afternoon, everyone. My name is Osai Give. Today, I'll be talking about the challenges and debates in the NHS Lean implementation, the risks associated in the NHS implementation strategy, and conclusion. The benefits of the Lean system cannot be overemphasized. That is not disputed. However, there are some barriers to this implementation. One of them is the Lean principle. It has not yet been effectively communicated to staff. There is also strong resilience to change. Now you see poor communication and strong resilience to change. These two are fundamental in the success of this principle must be attained. It has been said over time that this Lean principle tries to place more emphasis on workload than on staff well-being and engagement. So it is more of work instead of staff work-life balance. And we all know that if the staff work-life balance is affected, productivity will also be affected. And if productivity is affected, then it means that the Lean principle cannot be achieved. There are some risks associated in the NHS, and the NHS faces the medium to high level of risk, not just because people are not doing their job, but because it is a huge complex system caring for millions of people every day, often with limited resources. Number one risk is the clinical risk, is medium to high. High areas of line emergency care, patient incidents, operational risk is medium. Lean and digital transformation efforts help reduce this, but variability across trust keeps the risk at a medium level. Financial risk is medium to high. NHS often operates under tight budget, risk overspeed, under funding, and meeting emergency targets. Mitigational risk strategy. There are some few mitigational strategies that we put in place to fight against these challenges. One of them is continuous feedback. So gaining feedback from the workers, from the staff, we help successfully implement this lean principle, this lean system. Now, this feedback can come is positive and negative. Even if they are negative feedback, it will help the policy implementators to know what areas to focus on. Also, another mitigation strategy is emphasis of the employee well-being. Emphasis of the employee work-life balance, because the work-life balance of the staff need to be intact for productivity to be attained, not just productivity but maximum productivity. Another strategy is investing in staff training and support. So staff need to be trained on the lean system. We can't just guess that they know it. We can't just guess that they can do it. Training needs to be done. In-depth training needs to be done in order for them to get used to the system and successfully implement it. Another mitigation strategy is flexible application of lean principles. Flexible in what sense? It means to be able to adapt to changing circumstances. So events might occur in the system that might need principle to be adjusted to fit into the system. In my conclusion, I will say that if this issue can be addressed, then the lean system, the lean principle will go a long way in achieving its aim and objective. We need to create a system and equilibrium whereby the staff are doing well and the system is also doing well. As much as you can think it, lean principle is as important as the staff, and the staff is as important as the lean principle. The both of them work side by side for them to attain success. Thank you.